As this issue continues to evolve, we are fortunate that Massachusetts is home to world-renowned hospitals and leading healthcare experts that are planning and preparing our communities and providing us with guidance. The general public in Massachusetts remains at low risk, but we are planning and preparing for the potential for more cases to develop here. I think we all know that this is stressful for people, but health experts have advised that a virus like this is not deadly for the vast majority of people who may get it. But as Director Martinez said, it is contagious, and if someone comes in direct contact with someone who has it, they might get it themselves. That means every person has a responsibility to play a part in containing coronavirus and other germs by following some simple steps you've already heard before. Wash your hands for at least 20 seconds with warm water and use hand sanitizer. Cover your mouth with your sleeve if you cough or you sneeze. Stay home if you're not feeling well, and call your healthcare provider if you are experiencing flu-like symptoms, and seek their guidance on the best course of action for your treatment. Our administration is working with experts and officials from our network of hospitals, first responders, local boards of health, long-term care facilities, and educational institutions. MEMA is holding weekly calls for interagency planning to coordinate with key stakeholders on long-term planning and resources should they need to pursue them to be deployed. There's an immense amount of planning and coordination that goes into preparedness efforts, and that will continue. DPH has and will continue to provide clinical and infection control guidance for hospitals and healthcare systems. Some examples to date include disseminating detailed public health guidance and recommendations to school superintendents and principals throughout the Commonwealth, and issuing guidance to long-term care facilities, including nursing homes and rest homes. We understand there are questions about international travel, and earlier this week, our administration urged colleges, universities, and high schools to cancel upcoming organized international trips at this time. Taking this precaution will help us protect both the students and the Commonwealth, as we are home to such a large number of colleges and universities. There have also been questions around large venue gatherings. We're closely following the guidance that's issued by the CDC on travel restrictions and urge all residents to follow that guidance. And here in Massachusetts, we urge organizations that are hosting large venue events to take extra universal prevention precautions. This includes disinfecting surfaces and providing personal hygiene products to attendees. It's important everyone uses common sense on this particular issue. Practice good personal hygiene and stay home if you're not feeling well. Have we said that enough times? You're going to hear it again. We will continue to follow the guidance of the CDC and encourage everyone in the Commonwealth to do the same with respect to their daily activities. Our administration remains committed to serving as a resource for the City of Boston and for all entities who are on the front lines of these ongoing efforts. And please continue to check the banner at the top of mass.gov for important updates as they become available. And we'll continue to keep people informed as new information becomes available to us. Again, I understand that this is stressful for many people. But as I said earlier, experts from the U.S. Center for Disease Control and the World Health Organization are finding that for the vast majority of people who contract this disease, it is not deadly. It's also important to remember that the spread of this disease can be pushed back. Some parts of the world have started to see some positive progress that were involved in some of the earliest outbreaks. But that's only made possible by people paying attention to the guidance that local, state, and federal officials are putting in front of them. And it requires people to pay close attention to their actions. Lots of hand washing, covering coughs, and staying home if they feel sick. This is a very serious disease, and we were pursuing all appropriate action and developing the resources that we need to confront it. And we will continue to offer everyone the most complete information we can as it becomes available. I also want to thank the City of Boston and many of our local colleagues across the Commonwealth for their steadfastness, their cooperation, and their leadership on this. For more